Greetings, I'm Eric Wood. I'm the Director of the Occupational Medicine Residency at the University of Utah Rocky Mountain Center for Occupational and Environmental Health. I'm very pleased to be able to speak to you all today and talk about our program. We're now in the 5th decade of the residency, having been founded in 1978. We've got 117 graduates of our program, and our alumni are scattered throughout the nation in all sorts of leadership roles across the spectrum of occupational medicine practice, from corporate to clinical to governmental work. So we're incredibly pleased with what we've been able to do and really grateful that you all are here with us as well, supporting us in many of the things that you do, contributing as preceptors both locally and afar, your contributions to our alumni program, and just simply joining us in our alumni activities. We developed a Master of Occupational Health degree, which is now in its 13th year. As many of you know, our residents have had great opportunities traveling out of state to do training rotations from places like NASA in Florida to Chevron in Texas to Idaho National Labs, the Department of Energy programs. These are great opportunities for training for our residents, and we really appreciate having the funding to support them in those travels out of state. We also have our great clinical rotations locally with our own occupational health clinic here at Redwood Health Center and South Jordan Health Clinic, as well as our collaborators here in Utah, Intermountain Healthcare WorkMed as well. We have many of our alumni continuing to help educate our residents through preceptorships at those programs. We look forward to the coming years ahead. The program continues to grow. We continue to fill our program with highly qualified applicants and recruiting really strong people from across the nation. So thank you all for all you've done. We appreciate you being here and look forward to the coming decades ahead.
Hi, I'm Kurt Hagman. I direct the Rocky Mountain Center for Occupational and Environmental Health, which as of 2021 is now a multi-university program under Utah State Code. And so we're at both the University of Utah and Weber State University. We're one of the original education research centers founded by Bill Rahm in 1977. We also, as of 2022, have now received new funding support from the Utah State Legislature in the amount of $2 million a year. So we're most grateful for the vote of confidence by our policymakers. In 2021, the Rocky Mountain Center moved into brand new space for the first time since its inception. This space was provided by a grant of over $1 million from WCF Insurance, for which we are most grateful. This doubled our space, provided us examination rooms, provided us with 2 laboratories and 3 classrooms, the largest of which seats 83. So we can now do far more education and research for occupational safety and health issues in the state of Utah and beyond. The examination rooms, of course, are extraordinarily helpful for our occupational medicine program, as well as for enrolling research subjects. We additionally have 2 clinics in the Valley in 2 different locations.
Hi, my name is Dr. Melissa Chen, and I am one of the occupational medicine physicians at the University of Utah Rocky Mountain Center for Occupational and Environmental Health. I've been with the center for a little over 10 years, and one of the things that I've really enjoyed about working with the center is the academic freedom it's given me. In 2020, it gave me a chance to pursue my other passion for medicine, which is in the world of substance use and addiction, especially in the setting of the working population. And in 2020, I went and completed my addiction medicine fellowship at the University of Utah Department of Psychiatry. Since completing that fellowship, I'm now double boarded in occupational medicine and addiction medicine, and 30% of my time I run the inpatient addiction medicine consulting service at the University of Utah Hospital. This has been a great opportunity to really have a niche practice of addressing both the occupational medicine needs of people struggling with addiction. I've had an amazing opportunity to work with the Utah DOPL for healthcare professionals struggling with addiction.
Hello, my name is Jeremy Biggs, one of the occupational medicine physicians here at the center. and the Division of Occupational Environmental Health. Been on the faculty since 2009. Here to talk a little bit about what we're doing in relation to the University of Utah main campus health and safety. So we're here in the Union Building. This is where we have a clinic space. As we all know, this is a robust research institution as well as other activities, which makes it a great place to be, but also makes it a complex occupational health and safety program that we needed to develop. This is something that we've been working on for several years with our partners in environmental health and safety here on campus, as well as Maine HR and the president and their cabinet. There's a lot of different exposures throughout campus. So we've been working several years to try to identify those exposures and then develop an occupational medicine program to help monitor our employees to keep them safe while they're working.
Hi, my name is Andy Phillips, and I'm an occupational medicine physician with the Rocky Mountain Center. These past 2 years have presented the center with a number of exciting and unique opportunities. As the pandemic spread across the globe, many non-essential businesses, clinics, and unnecessary surgeries were shut down. As a center, we recognized that our patient population were the very essential workers which would provide the necessary services to keep our communities going. We fought to keep our clinics open so that we could provide care for those essential workers. In addition, we recognized that there was a PPE shortage, and unless we found solutions, those very workers who were working on the front line would be at risk. We partnered with IHC and harnessed the strong volunteerism nature of the Salt Lake community in an undertaking called Project Protect, where we produced 5 million surgical masks and tens of thousands of isolation gowns and face shields. Additionally, we partnered with the Center for Medical Innovation, where we were able to innovate a homegrown PAPR because commercially available PAPRs were no longer available, and we needed to find ways to protect our workers. These PAPRs were just as protective, and they were available because the materials could easily be sourced. Finally, as the pandemic has shifted into an endemic phase, we've continued to work with the Center for Medical Innovation in developing a health-centric reusable respirator so that we can shore up our supply chain and prevent such shortages in the future.
Hi, I'm Sarang Yoon. I'm an occupational medicine physician and also the principal investigator for the Recover and Protect COVID-19 studies. Both studies are funded by the CDC and are multi-site. There are over 8 sites in the United States involved in this study. The study looks at asymptomatic and symptomatic infections in frontline workers and their children over the past 2 years. With this funding, the center has hired over 40 research assistants and staff, and we have also published in high-impact journals such as MMWR and the New England Journal of Medicine. We just received notice of extension of the study to year 3, and it is our hope that these studies will contribute to public health and ultimately our frontline workers.
Hi all, Matt Hughes here to tell you about some exciting new developments that have occurred in the past few years with the Rocky Mountain Center. As you may have heard by now, the Utah legislature has passed statutes in 2021 and 2022 in support of the center. The first statute created a joint partnership between the University of Utah and Weber State University to host the Rocky Mountain Center. That means the center now has direct line reporting to the senior leadership of both institutions. With this new partnership and reporting structure, we are stoked to be able to make several changes. First, continuing education will be hosted by Weber State University. Weber State has a very large and robust CE program and will provide a great platform to build the CE offerings of the center. One recent development in association with CE is that we assumed the responsibilities of the Red Rocks OSHA Training Center in Colorado. And now our reach will be effective overnight into many other locations in Colorado and Utah and surrounding states. We're also going to add an undergraduate degree program in occupational health and safety through Weber State. This will be a great opportunity to train the next generation of occupational health and safety professionals, and will be a great pipeline for the graduate programs at the Rocky Mountain Center. Finally, we intend to restart the nursing program in occupational nursing at Weber State University. We are in early efforts to determine what that program will look like, but essentially we'll start with a certificate in occupational health nursing, and will likely lead to graduate degree programs in occupational health nursing. I hope you can participate and benefit in some of these newly expanded programs, and hopefully it'll help your career in some way, and we also hope that you'll be able to help support us in our efforts. Thanks so much.